This video demonstrates successfully administering a subcutaneous injection.
Your patient is receiving sliding scale insulin to manage their glucose. You just performed a finger stick and the result was 250. Please give your patient their NPH insulin now. Perform hand hygiene with sanitizer. Check medication order and verbalize 6 medication rights prior to medication preparation, including right patient, medication, dosage, time, route, and documentation.
I'm going to check my computer for the order, and I see that I'm supposed to give insulin SubQ now. I'm going to give 10 units according to the sliding scale because her glucose was 250, and I'm going to give it to my patient, Susan.
Check allergy status.
There are no allergies in the computer.
Verbalize checking for contraindications of medication.
There are no contraindications for this medication.
Verbalize administration rate if stated in medication info.
Medication info tells me to give this medication at a rate of 10 seconds per amount.
Verbalize first check, including reading the EMR order, comparing the medication label to the order, selecting the proper medication ordered, and checking the expiration date.
So I'm looking at my EMR, and there is an order for NPH, which is what I have. The amount of 10 units per 250 for her glucose, and the expiration date, which isn't until 2024.
Perform dosage calculation correctly and verbalize dosage.
So this patient is going to get 10 units, which comes out to 0.1 mLs.
Don clean gloves. Verbalize second check, comparing med label to EMR, including medication label, calculated dosage, correct route and time, and verify with a second RN.
So I'm going to give NPH, which I have an order for. I'm going to give 10 units, which is 0.1 ml. I'm going to give it SubQ now, and I'm going to verify this with another RN.
Clean off the top of medication vial with alcohol swab, rubbing top of vial for at least 15 seconds. Choose correct needle and syringe for administration. Remove needle cap, maintaining sterility. Withdraw correct amount of air into syringe. And inject air into medication vial. Withdraw correct amount of medication into syringe while removing any air bubbles. Verify dose with second RN. Recap needle after withdrawing medication syringe, using the scoop method with one hand, and then secure needle cap. Remove gloves and perform hand hygiene. Identify patient with 2 indicators, name and date of birth, and check for allergies.
Hi, Miss Susan. I am your nurse today, and I'm going to give you your insulin. Can you tell me your name and date of birth?
Susan Smith, 7/24/69.
Perfect. And do you have any allergies?
No allergies. Verbalize third check at bedside, comparing medication label to EMR. Scan medication and scan patient armband.
I'm going to do my third check at bedside. I'm going to be giving NPH SubQ now. I'm going to be giving 10 units, which is 0.1 ml, to Miss Susan. Scan it, scan her, and scan my medication.
Don clean gloves. Verbalize patient education, including the action and purpose of the medication.
I'm going to be giving you your insulin today, which is going to help bring down your blood glucose level.
Select appropriate injection site on patient and cleanse with alcohol swab in circular motion for 15 seconds.
I'm going to give you your insulin on the back of your right arm today.
Allow alcohol to air dry for at least 15 seconds without exposing the site to contamination. Remove the needle cap on needle and syringe by pulling caps straight off. Create skin fold for injection by pinching up skin with non-dominant hand. Hold syringe in dominant hand at a 45 to 90 degree angle and inject needle in a dart-like motion. Once needle is inserted, release skin fold, placing a hand on plunger, and inject medication slowly at a rate of 10 seconds per milliliter, maintaining steady needle. Engage the safety immediately following injection and place needle in biohazard sharps container. Assess site for bleeding and apply gauze gently if needed.
The site is not bleeding, so it does not need any gauze.
Remove gloves and perform hand hygiene. Verbalize documentation of medication administration, including site, amount of medication given, time, which medication was administered, and evaluation of patient's response.
So I will document that I gave Ms. Susan her NPH insulin, that I gave 10 units in the back of her right arm, SubQ now, and that the patient tolerated it well, and I will check her glucose to see if it helped.